Tonight we begin with the shocking revelations contained in a report by the Auditor General raising queries over the technology system running the controversial healthcare scheme SHA. The Auditor General has raised the red flag of a shadowy account run by the suppliers of the system where 2.5% of SHA members' contributions is remitted on either daily or weekly basis without Kenya's approval. The audit report also highlights violation of the Public Procurement and Assets Disposal Act by procuring the system through specially permitted procurement procedure to single source the service provider instead of competitive bidding. Ayub Abdikadir begins our broadcast tonight with the breakdown of the Auditor General's bombshell on the workings of the troubled SHA.
Dr. Nancy Gathungu's audit report highlights glaring inconsistencies in the procurement of the healthcare information and technology digitization system used to run the Social Health Authority at the Ministry of Health at a cost of 104.8 billion Kenya shillings. The Auditor General revealing glaring inconsistencies in the tender paperwork, contract agreements and financial proposal. The auditor lifting the lid on how procurement law was violated, with no inclusion of procurement plan, nor a medium-term budgetary expenditure framework before the procuring of the system. The report details how the management breached the law by using uncompetitive procurement procedure in single sourcing a service provider of the digital system, violating Article 227 of the Constitution, which requires fairness, transparency, competitive and cost-effectiveness. Dr. Gathungu also discloses the contract entered into did not provide the scope of the work. The number of health facilities where the technology system was to be installed was never disclosed. Despite a cost price of 7 billion Kenya shillings for training, there is no explanation to show for the number of healthcare workers to be trained on the system and the mode of training to arrive at the cost. According to Dr. Gathungu, the management was in clear breach of the law. The report also exposes a lack of payment arrangement agreement. According to the financial proposal, the consortium proposed a funding model where 2.5% of member contribution from the Social Health Authority, 5% of claims from health facilities, and 1.5% were to be used to pay for the service. The 1.5% is to come from track and trace solution. The Auditor General states that the remittances would yield 111 billion Kenya shillings in 10 years, and further adds that the money is transferred to an escrow account daily at a frequency of not less than 1 week.
It's a loan that has to be serviced by the national government.
Her position was also corroborated by the Controller of Budget when she appeared before the National Assembly's delegated legislation, saying that the Housing Fund and the Social Health Authority contributions are not deposited in the Consolidated Fund Services.
Then there was the question from Mheshimiwa Kuria there on the Housing Fund. Now, I need to bring out the fact here that there is a lot of money that does not pass through the COB. And the Housing Fund, the SHIF, like you have seen, the Railway Development Fund, the Petroleum Levy, all these funds are operated outside the Consolidated Fund and therefore not part of what I approve.
An examination of the Auditor General's report also reveals unfavorable contract clauses where the State Department of Health is prohibited from developing another system or a product with similar functionalities. The contract, in part stating that the procurement entity nor the government agencies are authorized to access the system in order to build a similar product. Dr. Gathungu's report also points out non-compliance with 1/3 rule of basic salary, in contrast to the Employment Act. The report also points out non-compliance by the Ministry of Health with staffing of persons with disability. Receipts and payments by the Ministry of Health showing compensation of employees amounting to 8.3 billion Kenya shillings. However, an analysis of the master roll revealed that the State Department of Health has 1,394 staff, out of which only 32 are persons with disability. The revelations by the Auditor General come a day after President William Ruto broke his silence over the challenges facing his administration's healthcare program, striking an assuring tone in the midst of an exponential growth in out-of-pocket expenditure and public outreach due to system failures and downtime, locking out hundreds of Kenyans from medical care and attention. Ayub Abdikadir, Citizen TV.